Thinking about your fertility appointment, it's totally normal to feel a bit anxious. I'll be discussing what to expect at that appointment so you walk in there with some confidence and well prepared. So, the very first thing is actually to read your appointment letter because some clinics are very detailed in explaining what exactly is going to happen at that appointment. And also try and arrive early so that you're not flustered from, say, trying to find parking. The first step of the appointment will be reviewing your medical history. This will help us to just have an idea of your general health and also to pinpoint if there's anything in your medical history that gives us an idea of why you're having difficulties getting pregnant. This would involve taking your menstrual history, your sexual history, talking about any medical conditions you have that you're on treatment for, also discussing any previous pregnancies, irrespective of their outcomes. So, whether you had any miscarriages in the past, previous successful term pregnancies, the type of deliveries you had, whether vaginal or cesarean sections. We'll also be discussing any surgeries you've had in the past, especially if they were gynecological surgeries. Social history, including smoking, alcohol intake, will also be discussed. Now, if this is a couple's appointment, we'll also be taking a medical history from the partner, discussing similar things like the medical history of the male partner, any surgeries, especially groin procedures, and also social history, including smoking, alcohol intake, and also use of steroids or protein shakes for muscle bulking, as this has a bearing on fertility. The second step of the appointment is performing the physical examination. This may or may not involve performing a pelvic examination and an ultrasound scan. If it's your first fertility appointment, you're probably going to have an internal scan or transvaginal scan, which involves inserting the ultrasound probe through the vagina. Now, this is called a baseline scan and is to help us have a clear idea of how your gynecological organs are. So we'll be looking at the uterus, which is a womb, looking at the size, looking at the position, also having an idea of how the inside of the womb looks, if there are any abnormalities like fibroids. We'll be looking at your ovaries to look for any abnormalities like cysts, and then also counting what follicles we can see. The third step is requesting for investigations. So I'll be discussing fertility investigations in a subsequent video, but broadly speaking, we request blood investigations to check hormone levels, to find out how healthy the ovaries are, and also to detect any underlying abnormalities like polycystic ovary syndrome, thyroid problems, or problems with your prolactin levels. We'll also want to check your rubella status to make sure that you're rubella immune, as this is important for fertility. In addition to this, we would screen for infections like hepatitis B, hepatitis C, and HIV. For the male partner, we would usually be looking for the seminal fluid analysis and also screening for the same infections. In the fourth step of the appointment, we will be discussing treatment options. Having taken a full history, examined you, or had an ultrasound scan done, we'll be discussing all the treatment options available. The first is usually lifestyle modification, and this could be advising you about optimizing your weight, which could be gaining some weight if you're underweight or losing some weight if you're overweight or obese. We would be talking about smoking cessation, minimizing alcohol intake, or stopping steroid ingestion for the males. In addition, we'll be discussing the use of medications like we would do in ovulation induction, other treatment options like artificial insemination and IVF. In the fifth step of the appointment, we'll be answering any questions you have from the consultation. Now, we know that it's usually overwhelming, and we would have given you a lot of information during that consultation. So we give you patient information leaflets and also signpost you to where you can get more information about what we've discussed. We also make sure that you have contact information for the clinic, including phone numbers and emails, so that you can reach out to the clinic if you have queries about your consultation or about what is to happen to you subsequently. Now, the sixth step of the appointment, and one of the most important, is making sure that you are aware of all the support that's available to you as a fertility patient. This includes support groups and access to a clinical psychologist. Now, it's important to note that you can have access to the clinical psychologist before treatment, while you're undergoing treatment, and after your treatment for fertility, irrespective of the outcome of the treatment. And it's also important to note that this person is independent of your treatment team, so it's like a third party that you can comfortably discuss your concerns with. Finally, your fertility appointment should be relaxing and reassuring, and you should leave that appointment with a clear idea of the plan for your treatment and what is to come next. I hope this video has been helpful. If you have any questions about an upcoming appointment, please feel free to drop a question in the comment section and I'll get back to you about it.